Order. Questions for oral answer. Dr. Lim Wee Kiat.
Mr. Speaker, may I have your permission, please, to address oral questions 1 through to 12 from the order paper today?
Yes, please.
Thank you, sir. My answers will also address questions filed by Mr. Henry Kwek for future sittings. Mr. Speaker, the safety and well-being of Singaporeans remain our top priorities for the vaccination program. Only vaccines that meet strict standards of safety, quality, and effectiveness will be used for our population. For our vaccine program to be successful, education and outreach play a crucial role. Singaporeans need to understand why vaccination is important in the fight against COVID-19 and be confident that the vaccines that we are using are safe and effective. We must also communicate clearly when and how they can get vaccinated. MOH, the Ministry of Health, has made available general information as well as detailed advisories through multiple channels. The MOH website provides information on the groups currently deemed contraindicated or not, as recommended by the Expert Committee on COVID-19 Vaccination, EC19V, to take the COVID-19 vaccine. For example, pregnant women, children below 16 years of age, or those with a history of anaphylaxis or severe allergies, such as eye, mouth, or facial swelling, difficulty in breathing, and/or a fall in blood pressure, are not recommended at this stage. Persons who are unwell or have had fever in the last 24 hours are also advised to postpone their vaccination until they have recovered. Members of the public may call the MOH COVID-19 hotline for assistance if they have medical queries. They may also consult their own family regular doctor. All our medical practitioners have been provided with the detailed clinical definitions of indications and contraindications to vaccination, including, for example, what is considered a history of anaphylaxis or severe allergies, or the definition of a severely immunocompromised person. They will be able to advise any individual on vaccine-related queries, including evaluating the specific individual's suitability for vaccinations. Every individual will go through a screening process at the vaccination site before being vaccinated. Each person will have to declare their relevant medical conditions based on the vaccination screening form provided. A final check on the individual's suitability and fitness for vaccination will be assessed by trained healthcare personnel at our vaccination centers and polyclinics. These personnel will have on-site access to an individual's salient medical history in the National Electronic Health Records, if necessary, before the individual is allowed to be vaccinated. We've made good progress in our vaccination program. As of the 31st of January 2021, yesterday, more than 155,000 individuals have received their first dose of the vaccine. More vaccination centers will be set up over the next few weeks to ensure that everyone can conveniently receive their vaccinations. The vaccination centers will be located in high population catchment areas, as well as along public transport routes for greater accessibility. In total, we are planning to set up around 40 vaccination centers, with each vaccination center planned for an estimated capacity of about 2,000 vaccinations per day on average. I'll say that again. Each vaccination center is planned to have an estimated capacity of about 2,000 vaccinations per day on average. Besides the vaccination centers, the polyclinics and selected public health preparedness clinics, PHPCs, will also serve as vaccination sites. Currently, vaccinations are performed at 9 polyclinics and at around 20 PHPCs. From the 1st of February 2021, today, all 20 polyclinics across Singapore will also begin offering COVID-19 vaccinations. Our polyclinics and PHPCs are wheelchair accessible. To reach out to seniors with more serious mobility issues, we have set up mobile vaccination teams. We have begun vaccinations for seniors in the community. All seniors will receive personalized letters inviting them to make an appointment for their vaccinations. They will also be able to make appointments online, or they can visit selected community centers near to them to book an appointment in person. Community volunteers from the People's Association and our Silver Generation ambassadors will be conducting house visits to answer queries and to help our seniors book an appointment if necessary. We're very grateful for the support and participation of the community in this important national effort. The Ministry, the Health Sciences Authority, and the Expert Committee on COVID-19 Vaccination have been monitoring international reports on vaccine-related adverse events and deaths in elderly recipients. The Norwegian health authorities and the World Health Organization's Global Advisory Committee on Vaccine Safety have found no evidence that the Pfizer-BioNTech vaccine contributes to an increased risk of death in the elderly. Thus, we continue to offer COVID-19 vaccination for our seniors. It's important, it's vital to vaccinate and protect seniors, as COVID-19 infection in the elderly has been observed to result in severe or fatal illness. Nevertheless, the Ministry has reiterated to vaccination providers that doctors should review the medical history of seniors carefully to confirm if they are indeed suitable for vaccination, and that they should be monitored closely in the immediate period after a vaccination. As with other vaccines, people who receive the COVID-19 vaccine may experience injection site pain and swelling, fever, headache, fatigue, and body aches. These mild symptoms generally resolve within a few days. Among those who've received the vaccine, there were 4 reported cases of anaphylaxis. Among those who received the vaccine, there were 4 reported cases of anaphylaxis, which is the rapid onset of severe allergic reactions. The individuals in their 20s and 30s developed multiple symptoms such as rash, breathlessness, lip swelling, throat tightness, and giddiness. 3 of the individuals had a history of allergies, including allergic rhinitis and food allergy such as to shellfish, but none had a history of anaphylaxis, which would have precluded them from receiving the vaccine in the first place. Anaphylaxis can be controlled when detected and treated in a timely manner. As all vaccinated persons in Singapore are closely monitored, the symptoms in these 4 individuals were promptly detected and treated. All have recovered from the episode. 1 was under observation for a few hours, while the others were discharged from the hospital after a day's observation or treatment. None needed ICU support. The incidence rate of anaphylaxis locally is about 2.6 per 100,000 doses administered. The incidence rates reported abroad is around 1 to 2 per 100,000 doses administered, after these other countries have administered millions of vaccine doses. Variations in the incidence rate are to be expected initially when the numbers vaccinated in Singapore to date are relatively small as compared to other countries. Currently, the benefits of getting vaccinated to protect oneself from the effects of severe COVID-19 disease and its complications far outweigh the risk of any potential adverse events known to be associated with vaccination. We will continue to closely monitor the safety of the vaccine and ensure the vaccines used in Singapore are safe for our population groups. We seek everyone's patience and support as we progressively roll out the vaccinations to the whole population in tandem with the shipments of the vaccines. We have signed advance purchase agreements with Pfizer-BioNTech, Moderna, and Sinovac, and are in discussions with a few other pharmaceutical companies. Due to commercial sensitivities and confidentiality undertakings in our advance purchase agreements, we cannot disclose the specific quantity of vaccines ordered or the delivery schedules. While there will be some delay to the shipments of the Pfizer-BioNTech vaccine due to the upgrading of Pfizer's manufacturing plant, we will continue to monitor our supplies closely to meet our target of vaccinating all Singaporeans and long-term residents in Singapore by the end of 2021. Given the present short-term limited supply of COVID-19 vaccines globally, there's a need to prioritize the vaccinations at this point in time. We have prioritized healthcare workers and COVID-19 frontline personnel, whose work requires them to be in constant contact with individuals who may be infected. These personnel include swabbers hired by Health Promotion Board, staff working at government quarantine facilities, community care facilities, and dedicated stay-home notice facilities. Seniors are at a high risk of severe or fatal illness if infected, and hence they are also given priority for vaccinations. We have also vaccinated essential workers, such as those in our security services and our aviation and maritime workers, who have a higher risk of exposure to infected individuals in the course of their work. We must keep our essential services going. We completely understand the anxiety of Singaporeans who wish to travel overseas for personal reasons or who would like to get vaccinated early. At this point, when vaccine supplies are limited, we do need to prioritize our healthcare and frontline workers and seniors for vaccination. We are therefore unable to provide vaccines at this time to Singaporeans outside of these groups and seek their understanding. When there is greater certainty in our vaccine supply, we will consider allowing these individuals to receive early vaccination. We will announce further details at that time. Further details on the vaccination rollout to the rest of Singaporeans and long-term residents will be announced later on. Thank you, Mr. Speaker.
Dr. Lim Wee Kia.
Thank you, Mr. Speaker. Let me just thank the SMS for the reply. I would like to ask the SMS that when the batch of vaccine reach a vaccination center, when it is thawed, which means that it has to be used within 6 hours, if I'm not wrong. So far, what is our experience now when we thaw this vaccine? How many of doses has been wasted because the person who had registered for the vaccine didn't turn up or whatever? So what is our wastage like now for this vaccine? That's number one. Number two, I'd like to ask, I think as a member of parliament, I do have requests now from emails from residents who are traveling, like what you just mentioned, requesting for whether can they have a chance to have early vaccination. So I would like to appeal to the task force and MOH to consider, to set up some form of registry for those who want, and to see whether can you all prioritize and then give them a chance for the public. That is them two. And we also have, we are recruiting grassroots leaders now to help us as vaccine ambassadors. And some of the grassroots leaders has also been asking, if they are to be vaccine ambassadors, is it possible for the vaccine ambassadors to be vaccinated at the same time also, so they can better convince the residents to come forward to receive the vaccine? So my issue now is that if they go forward to do house visit, to ask them to convince residents to do vaccination, but they themselves are not vaccinated, then it's very hard to convince. That's the other point. Last of all is that this side effects monitoring. Currently now, when I receive my vaccination, of course, there's a QR code for me to report the side effects. Is there a proactive method of sending those who have been vaccinated, for example, 3 days after the vaccination, to ask them to fill up a survey form as to what are the side effects, and to ask them to actively sort of send the QR code to give the feedback? So I would urge the MOH to be a little bit more proactive to look out for side effects, because the main reason why people are apprehensive of vaccination is side effects. If we can convince people that the side effects are minimal and we can report and all the side effects can be effectively treated and quickly sort of nip all the myth inside the cyberspace, especially once in a while you have a Facebook post to say that somebody had been vaccinated in ICU, you have to really investigate the truth to make sure that it doesn't spread and people think that we are trying to hide something. That's last. Then last of all is that once we are vaccinated, is
Dr.
it possible?
Lim, can we just keep it to,
Okay,
I prefer
sorry.
members to keep it to 2 supplementary questions,
Okay.
so that others can ask, and keep your supplementary questions short.
Yes, sir.
Thank you.
I will just stop there. Thank you very much, sir.
Mr. Speaker, I thank Dr. Lim for his questions. Our wastage rates are low. I don't have the specific number at this point in time, but in general, a vial is supplied to have around 5 doses. Because of the way the manufacturer does this, usually there's a bit more inside the vial. And I can tell you, on average, we're getting more than 5 doses per vial because of the way in which we've centrally controlled the thawing, distribution, as well as the training for the people who do the vaccination. So our wastage rates are low and well managed. I don't have a specific number at this point in time that I can share with Dr. Lim. For the early vaccinations, indeed, as we have set up a national appointment booking system, and we have a single online portal. So at the appropriate juncture, we would encourage members of the public who are interested to receive the vaccine, whether it's an early vaccination or as part of your schedule, to register their phone number, register their details on the portal. We'll get in touch with you as soon as possible. The suggestion about early vaccinations for grassroots leaders and other volunteers going out to convince seniors or to help seniors make the appointment is well taken. It may not be possible to ensure that everybody has a vaccination at that point in time, but perhaps we can go at least to the point of ensuring they have a booking. And then when you're facing the senior, you can say, well, I haven't got it yet, but here's my appointment. and I know that I'm going to get it because I've committed to doing so. For the adverse event reporting, I would point out that almost all adverse events documented from vaccinations tend to have an onset very close to the administration of the vaccination. So, and that's hence why we're monitoring them for 30 minutes, and perhaps we're monitoring them for longer than necessary at 30 minutes. Nevertheless, the use of a single online process, as well as the network that we've talked about, I mentioned earlier in my reply about how we are administering the vaccination process as well as administering the vaccination doses, means that there is a certain set number of places where information can flow into, and members of the public should approach either the place where they had their vaccination, call the hotline where they made the booking, frankly turn up to any one of our medical service providers, and the information around that adverse event will flow through to a single interface, and we will have sight of that across our nation so that we track the adverse events very, very closely. But as I explained in the earlier reply, our adverse events are well within the expected rate. Thank you, Mr. Speaker.
Mr. Jerogam.
Sir, given that the government has signed advance purchase agreements with Pfizer, Moderna, and Sinovac, will these agreements have any bearing on whether the latter two vaccines are eventually approved? Secondly, will MOH roll out only the safest and most effective vaccines available, or are there other factors like price and country of origin that are considered?
Mr. Speaker, the factors taken into account as to whether a vaccine is licensed for us here in Singapore is quite simply that they have strict standards of safety, quality, and effectiveness. And that is the process through which the license is evaluated for the vaccine and how we manage the process going forward. I'm afraid we can't talk too much about the agreements that we have with the various companies because of the confidentiality of those undertakings.
Mr. Darrow David.
Just have one supplementary question. It's heartening to know that the cases of people who respond with anaphylactic responses are low. And as SMS has shared earlier, it's good to have all the information of how things are coming along openly and transparently shared. Would the government also consider perhaps a whole-of-government communication approach using various platforms, different types of communication methods, capsules, and so on, so that this information, as it's constantly coming in, can also perhaps be communicated out there to our public, especially perhaps our seniors who might be more comfortable with certain vernacular, be it the Chinese dialects or Malay or Tamil or even other languages. If that's something the government can do, I think this will go a long way to communicate what's happening accurately to our public out there. Thank you.
Mr. Speaker, I thank Mr. David for his suggestions. This has begun. MOH, and together with all the different government agencies involved, coordinating a whole-of-government comms approach. MCI supporting this as well. We will produce material in a variety of languages. We will produce material for different levels of interest, the top-line messages all the way down to the detailed advisories for the healthcare practitioners. And we will distribute this across a variety of channels: letters, online, mainstream media, broadcast media. And we would ask for members of this House to also assist us in participating in this communication to make sure that we do reach every Singaporean, every resident, explain to them the essential nature of this vaccine operation. This is to protect them, their loved ones, the community, their family, and the whole country. Every single vaccination that we are able to get done will break a chain of transmission and slow down the spread of COVID-19. Explain to them that this is a medical process, and medical processes will have risks, Hence, we've put in place a very stringent controlled environment and a series of control processes to minimize that risk and monitor them and help them thereafter. Explain to them that the vaccination is safe. The technology that has been developed, the specific vaccines that have been licensed are well researched, and we have many millions of data points to assure ourselves of the safety and effectiveness of these vaccines. Thank you, Mr. Speaker.
Mr. Murali Pillai.
Thank you, Mr. I thank the Honourable Senior Minister of State, Dr. Janil Puthucheary, for his comprehensive answers to the 12 PQs. I have a supplementary question in relation to donees under the lasting powers of attorney and deputies appointed by the court under the Mental Capacity Acts in respect of senior citizens aged 17 above. For these group of people, I wonder whether MOH or any other government body could provide some additional assistance, perhaps developing FAQs for them so that they are able to understand what their duties are under the respective LPAs and under the court orders, and kind of juxtapose it with the duties under the, or the requirements under the vaccination program. Thank you.
Mr. Speaker, I thank Mr. Murali Pillai for the suggestion, and we will look at it, and it's a good idea. I would just suggest that it's not too different from the current duties and responsibilities for donees and deputies with respect to the medical care that they, for the people under their guardianship. So there's not going to be a lot of difference from that, but the specific information as to how they would exercise those duties and responsibilities, indeed, we should make very clear, and we should do so.
Ms. Alex Yam.
Thank you, Mr. Speaker. Two supplementary questions for the Senior Minister of State. First, over the weekend, the European Union has issued rules tightening the export of vaccines manufactured within the EU region. I'd like to ask, how does this affect our vaccination rollout and the supply to Singapore? Related to that, will we at some point consider also vaccine production in Singapore to avoid any of these future issues? On a more practical level, on various parental platforms, there's been a lot of questions from nursing mothers regarding some confusion over advice on vaccine safety for those who are breastfeeding. The current advice on the MOH website and various healthcare websites in Singapore indicate that nursing mothers should consider suspending breastfeeding for 5 to 7 days after vaccination, but then also proceed to say that if mothers are unable to suspend breastfeeding, they should still proceed to vaccinate themselves. So there's some confusion over this advice, and they're wondering if there's any other safety issues that they should consider before proceeding to vaccination. Thank you.
Mr. Speaker, I thank Mr. Alex Yam for the questions. There are no plans to change our targets for vaccine rollout. Again, I can't discuss the specifics around our arrangements in terms of purchases and supply, volumes, delivery schedules, but our plans remain unchanged. For vaccine production, locally, indeed, it's something that I'm sure will be explored, but ultimately it comes down to the licensure of a specific vaccine that's demonstrated to be safe and effective for our population. For the nursing mothers, the short answer is they should consult a health practitioner, the family doctor, or one of the hotlines or a service provider to get specific advice about their case as to whether or not they should proceed with the vaccine or delay the vaccine, or delay breastfeeding, have the vaccine immediately, and it depends on the specific individual case of the mother. But if I could sum up the position and explain some of the reasons for the confusion, there is no absolute contraindication for a breastfeeding mother to proceed with vaccination. It is simply that we don't have enough information at this point to be so clear that they should do it without ceasing breastfeeding for 5 to 7 days. Ceasing breastfeeding for 5 to 7 days is the general advice that we would give for medications, because that's the length of time that it persists in breast milk, and after that, thereafter, it's safe. The one way to look at it is if the mother has to weigh up the risks to her and her child should she come down with COVID-19 infection, and hence, on balance, it is probably better for her to get the vaccination, protect herself, protect her child, protect her family. But an option is then to delay the vaccination until breastfeeding has ceased, and that's also a viable way for these mothers to proceed. But I think in short, consult the doctor and get some specific advice on your individual case. Thank you, Mr. Speaker.
Mr. Yip Hon Wing.
Thank you, Mr. Speaker. Thank the SMS for the reply. We note that there's currently a limited supply of vaccines. Will the ministry consider a wait list for those who want to go for early vaccination, especially if there are strong reasons for them to go overseas, be it for health, studies, business, or on compassionate grounds? Thank you.
Thank you, Mr. Speaker. I thank the member for his questions. It is something to be considered. We will be opening up the registration process, and we will be looking for an indication of interest from members of the public who are eligible in this phase as well as in the future.
Mr. Pritam Singh.
Thank you, SMS, for the update. Two questions. The first, pertaining to the certification of the Moderna and Sinovac vaccines, does SMS have any update on those timelines? The second question is picking up from Mr. Alex Yam's first supplementary question. Is the government still on track for vaccination of the entire population by the third quarter of this year?
Mr. Speaker, I thank Mr. Singh for his questions. I do not have an update on the certification of the Moderna and Sinovac vaccinations. That will be a process for the professional teams to study the data and make sure that our licensure process is applied with its usual rigor for all therapeutic interventions. Our plans haven't changed. Our plans were, of course, contingent upon the supply of vaccine, and the questions from the members indicate that their understanding and concern about how the supply of vaccine will affect our plans. Currently, our plans have not changed, and we anticipate our program to proceed as previously discussed.
Ms. Joan Pereira.
Thank you, Speaker. Thanks, SMS. Many elderly are still very unsure if they should take the vaccination. However, after I've explained to them that the doctor present will understand, speak to them, will understand their medical condition, and advise them accordingly, they felt a little bit more assured. But then they also asked another question. I can't remember the type of medication I take. So what happens if I don't give an accurate picture of my condition? So I told them, don't worry, if you give your IC number, the doctors will be able to advise you accordingly. Then they felt a little bit more assured. So can I ask if this item can be placed in the communication material so that at least the elderly on their part, they read it and they can understand? Thank you.
Mr. Speaker, I thank Ms. Pereira for the question. Indeed, she's absolutely right that when a member of the public attends a vaccination center, the polyclinic, the PHPCs, the screening process includes a healthcare professional going through your medical history as well as the medication that you've received. And if that member of public has any queries or uncertainties, please let us know. And the staff will have access to the information through the National Electronic Health Records and will be able to pull up what they need to. And ultimately, if they are still not sure, it's not there's a need to cancel the vaccination at all. You merely can defer the appointment until perhaps a fuller consultation with a healthcare professional who understands the situation of that senior and can make a recommendation. But in general, the information is available, and we'll be able to help assure that member of the public as to whether or not they can go forward with the vaccination. But I think to answer her specific point, to make that absolutely clear in the communication up front, that the people who are administering the vaccination will have access to these critical pieces of information is a very useful suggestion, and I thank her for that.
Mrs. Shahril Taha.
Thank you, Mr. Speaker, sir, and thank you, SMS Dr. Janil, for the clarification. Continuing off Mr. Yip Hon Wing's question, my supplementary question refers to students who are hoping to return back to studying overseas or intend to study overseas, given many of our A-level students are awaiting their results and have aspiration overseas. Since there is a restricted supply of vaccination and we may not be able to prioritize all of them for early vaccination, can the ministry also consider some communication or advisory to these students on the help that they can receive overseas so that we can continue to care for our students heading overseas? Thank you.
Mr. Speaker, I thank Mr. Taha for the question. Certainly, we will make available information through our MFA colleagues and their missions overseas as to how Singaporeans overseas can receive help. But in terms of Singaporeans overseas wanting to have vaccinations, and if they plan to return to Singapore to have those vaccinations, I would point out that the total duration required for the vaccination process is not short. With the Pfizer BioNTech vaccine, you need about 21 to 25 days between the two doses, and immunity is only achieved about 2 weeks after the second dose. So Singaporeans overseas that are planning to return to Singapore in order to have their vaccine need to plan for that length of time if they have a view that they need to be likely immune before they return back to where they're residing.
Sylvia Lim.
Thank you, Speaker. I have one clarification for the Senior Minister of State. I'm not sure if I heard him correctly in his initial reply regarding by when the government plans to vaccinate Singaporeans and long-term residents. In his original reply, did he actually say end of this year? Because I thought I heard him say that, and I think this is slightly different from the previous announcements that it would be done by the third quarter of the year. So I'd like a clarification on that. Thank you.
Mr. Speaker, I thank Ms. Lim for the question. We certainly have the capacity and the capability to vaccinate our population by the third quarter of this year. There's some uncertainty in terms of the take-up rate. So if, for example, there are members of the public who will need further explanation, who will need persuading that this is the right thing and the safe thing to do, or if there are members of the public who require further medical screening, these processes will take some time. Over the next few months, you can also anticipate that further information will be available from the vaccination process that is happening around the world. So there is a band that we are aiming for, somewhere between the end of the third quarter and the end of the year. Ultimately, the outcome will be determined by a combination of our supply as well as the willingness and engagement of Singaporeans and long-term residents to go forward to have the vaccination. Our ability to deliver on this is present and will be present. But we hope that the communication, outreach, and engagement necessary in order to make this happen is something that members of this House will assist with.